Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from beautiful downtown Moab, Utah. And in Moab, Utah, the solar eclipse was supposed to be amazing. And I can tell you, Janet and I were out riding our bikes, and it's like, what happened? What just happened? And in Washington State, it was supposed to be like 25% eclipse. And where we're at in Moab, it's supposed to be 55%. And it's like, I can honestly say I didn't look at the sun, but I couldn't tell anything that happened. But we do have some good friends in Texas, and they did notice a big difference. And the sky kind of went dark and stuff. And so anyway, I guess those of us that didn't get raptured, I don't know if anybody got raptured, but we're all here and alive, and the world didn't end, kind of like in Y2K. So I guess we can move on and talk about more things in the eclipse. And speaking of talking about more things, Jan and I are going to talk about something that we are very passionate about and that we talk about all day long to people all over the world, whether it be healthcare professionals or whether it be patients, and that is hormones. And that being said, we need to define hormones first. And I'm just going to say this. Hormones that's a very, very, very broad definition. And most people are so ignorant when it comes to the definition, whether they're healthcare professionals, whether they're doctors, whether they're pharmacists, whether they're nurses. They don't understand. They put hormones all in one category. And hormone is literally a messenger. They're messengers, and hormones can range from estradiol, which is a sex hormone, testosterone, which is a sex hormone, DHEA, which is adrenal hormone, epinephrine, which is an adrenal hormone, thyroid hormone, and even insulin. Insulin, which most people are familiar with, is a hormone. So as you can tell, those are very, very different hormones. They have very, very different effects on the body. So when you go to a doctor, possibly, and they say, well, hormones are bad for you, right away, you need to throw up red flags, because that is the most ignorant thing you could ever say. If somebody says hormones are bad, after what I just told you, without insulin, you will die. Without epinephrine, you will die. Without most hormones, you will die. So if you have somebody in healthcare that says hormones are bad, or hormones cause cancer, or hormones cause blood clots, or hormones cause this, cause that, that is a very broad definition, and they are ignorant. You need to do some more research. Janet.
So I feel like some of the falsehoods have been said because of the WHI study that was released. What was that?
2002.
2002.
And WHI, Women's Health Initiative.
So what this test or this study did is they took women on Premarin, which is a hormone, but it's made from a pregnant mare's urine.
Hence the name Premarin.
Right. And if we are equating human hormones, such as estrogen, like our estradiol and estriol, to Premarin, we are not in the same category. For example, we have 3, estrogen, which we don't use, estriol and estradiol, which we do use. And a horse has unlimited, 80 some perhaps?
Well, we know there's at least 19 different estrogens in Premarin.
In the urine.
And it's pregnant mare's urine. It is literally horse pee.
So the other hormone that they hit on was Provera, which was, and even now if you look at it, if you Googled Provera or even progestins, they would also throw progesterone in that category. We don't make medroxyprogesterone or Provera or progestins. Our ovaries make progesterone.
And our testes make progesterone.
Correct. And here's how different they are. Provera can be used to help with birth control, where if you gave a pregnant woman Provera, it would not be a good thing. She could perhaps even abort the child. When you're pregnant, you need to make progesterone, i.e., our body requires it to maintain the pregnancy. Like Shawn said, Progestation. The name comes from that, progesterone. It is one of the oldest hormones on the earth that has been looked at in humans. If you don't have enough progesterone, you will not cycle properly. You will not build new bones properly. You will not sleep properly, and you will not carry a baby properly.
That being said, if there is one thing that you can take away from this podcast, and you will know more than most gynecologists and pharmacists know about hormones, medroxyprogesterone acetate, Provera, the brand name, part of the drug in Prempro, Premarin and Provera, does not equal progesterone. Progesterone, progestation helps to support a pregnancy. Provera, medroxyprogesterone acetate, can help prevent a pregnancy. That's how different they are. We are taught in pharmacy school that they're close in structure, so they must work the same. Sure, they're close in structure, but remember, estradiol is close in structure to testosterone. Yet if you have enough testosterone, you'll be a man. So don't let people lie to you about these drugs being close in structure. They make a huge difference in the body because the way they interact in a 3D fashion. They're not two-dimensional molecules. They have a lock and key mechanism with many different proteins to turn things on and off. So any study that you see and it lumps, it tries to compare medroxyprogesterone acetate under the class of progesterones, I just quit reading it. You'll see the study headline like this: progesterone increases the risk of clots, blood clots. So increase the risk of heart attacks and strokes. Then you read in the details of the study. They use 10 milligrams of medroxyprogesterone acetate. I quit reading it from there. And I have to tell some doctors right away when they say, hey, check out this study. I'm like, no, I'm not going to read it. It's not progesterone. And so what the WHI study, you can take away from the WHI study, that said that Premarin and medroxyprogesterone acetate increase the risk of heart attacks and strokes.
It's true. It
did. And it did.
Does.
But that does not mean that the hormones our body makes up, estradiol and progesterone, increase the risk of heart attacks and strokes. And let's just think about that. If our bodies did, if estradiol and progesterone cause the risk of heart attacks and strokes, how come when women have high progesterone levels and high estrogen levels when they're younger, how come they don't have heart attacks and strokes? How come they have heart attacks and strokes when they're older, usually, and the progesterone and estradiol levels are lower? Seriously, let's just think rational about it. I think a lot of people that watch our podcast might agree to this, is that you can't trust the studies anymore. Let's face it. The studies are produced by big pharma. So they're going to say whatever that study is going to conclude whatever they want to conclude. Okay. And bioidentical hormones, which is what we're talking about today, mostly sex hormones, bio meaning life, identical to what our body makes up, they are not patentable per se. They can patent delivery devices and stuff, but they're not patentable per se. So there's not billions of dollars in them. So they're not ever going to show a study of the benefit of these hormones in our bodies.
Well, to come back to the main study that we are talking about, the WHI, they did follow women that were on Premarin unopposed, so estrogen unopposed, and that did lead to some issues. But then when they added medroxyprogesterone, it even compounded those issues. So I believe what they reported in there, but you can't draw the same conclusion to your natural body, because estradiol actually is health benefits to the vascular wall, and we need that to have a healthy vessel. We also need it for memory. We need it for maintaining good, healthy bones. But the balance of hormones, i.e. the opposing part, estrogen and progesterone, need to be in balance with each other to prevent problems. So yes, if you got a huge load of estrogen unopposed with progesterone, that could potentially be harmful. And we do see that as people in menopause, where they stored a lot of estrogen and they don't have enough progesterone. So it does put the body in a bad place if they are not opposing one another and balanced. And there's also a myth out there that kind of started with the study that if you're a woman and you have went through menopause, you don't need anything with progesterone in it, because you don't need it, because your uterus doesn't have to have progesterone anymore because you're not cycling. Well, progesterone actually tells your body to make new bone cells. I'm going to have new bone cells until the day I die. So how can we conclude that? Well, they looked at their study and said, well, we could only use it for 5 years. And that after that, they couldn't come to any conclusion that it was beneficial for women. So let's just take away that medroxyprogesterone. Well, thank God they did. But at the same time, I'm trying to point out that your natural body's production of progesterone does much more than oppose estrogen. It gives you new bone cells. It helps you sleep. Many benefits to it. And many times when we are counseling providers or patients about progesterone and estrogen, I usually don't even give estrogen until they went through menopause. And then once we are in menopause, we always make sure that we balance that estrogen with progesterone for the full benefits because they keep each other in check.
So what Janet is basically saying is that in pharmacy school, and what most doctors learn is that women, estrogen.
Right.
They don't think about the other sex hormones like estradiol, like progesterone, and like testosterone. We'll get into that a little bit later. So, and then here's what they really think. If they had a hysterectomy, so if you were an unlucky enough woman to have a hysterectomy, and if you've had a hysterectomy, that takes 10 years off your life. Do your own research. That's just what happens. I think most hysterectomies are unnecessary. I think if you can control a lot of things with hormone replacement and with diet and lifestyle, cutting your body parts out are very unnecessary. And it will put you into early menopause. And then what happens? Your cardiovascular health decreases, your libido decreases, your bone density decreases, and your life starts going downhill as if you're aging a lot faster, because your ovaries aren't there to make hormones. And even if your ovaries are still there, there's a lot of studies to show the detrimental effect of just removing your uterus. So that being said, what we're then told is if a woman doesn't have a uterus, she doesn't need progesterone. But like Janet said, and like we're talking about, I mean, that's the silliest thing. Let's think. Well, the studies say, trust the science. Let's just think rationally about this. Doctor, is progesterone a magic hormone that only works in one tissue in the body, like the uterus? That's a magic hormone then? Because most other hormones work in all places in the body, like your brain, like your bones, like your skin, all over the body. So just because you don't have a uterus doesn't mean you don't need progesterone. And remember, progesterone does not equal medroxyprogesterone acetate.
No, and I also think, sorry to interrupt, but
please.
That one of the first benefits that I reach for when I tell a provider to, reach for a dose of progesterone or help a woman with perimenopause or menopause, or even some of the girls that need help with cycling, is progesterone helps with your sleep pattern. And if you are not sleeping, you do not repair your body when you sleep at night, and your cortisol levels obviously are going to go off. So that in itself is prevention of inflammation, of exhaustion, and being tired. So if I can get somebody, or we can get somebody to have a better sleep pattern, which is a huge function of progesterone, because when it gets into the brain, it changes into L-pregnolone, and that helps us stay in our sleep cycle longer and keep our REM in a healthy place. And sleep trumps everything, folks, everything. If you aren't sleeping well, you've got problems, and they're only going to compound as we go along.
Nothing is going to get better if you're not sleeping better. It doesn't matter how well you eat. It doesn't matter how much you exercise. Things are going to get worse. And by the way, if you're not sleeping well, you don't lack Ambien. You don't lack some benzodiazepine or some of the latest and greatest drugs. I don't even know the latest and greatest drugs because I don't think they are necessary. Maybe very, very, very short term. But in general, I would never recommend a medication to help somebody sleep long term. There are just other issues to fix if you're not sleeping. And progesterone can be one of them. We see it all the time in women approaching menopause, how they can't sleep. And what do they do? What do the doctors do? Oh, you're not sleeping. Oh, your cycle started becoming more irregular. Well, you must need Ambien. We'll give you Ambien 10 milligrams every night so you can sleep better. Yeah, wait a minute. Again, if something is following your cycle, I don't care what it is. I don't care if it's headaches. I don't care if it's irregular menses. I don't care if your cycles are becoming non-existent. PMS, you're not sleeping around your cycles. If anything is affecting your cycles, progesterone. You don't need some fancy headache medication. You probably need progesterone. We have seen this over and over and over again. By the way, from anybody that's listening, please comment. We are here for you guys. We would love to hear your questions if you have any questions, and please share this so we can get the information out to other people. Janet?
So, Shawn took a good point there that we should point out. Our body does not have a deficiency of Premarin. It does not have a deficiency of medroxyprogesterone. So they're two different animals. So I totally agree with the statement that women shouldn't have those hormones. I would never put them inside of my body.
Never.
I agree with that. So if you're talking about blood clots, absolutely, Premarin would be a problem, and so would medroxyprogesterone. The only time that I would never recommend estradiol to a woman per se orally would be if they had some clotting factor disorder that's genetic. That's it. After that, basically, if you're balancing their hormones with progesterone, it will help balance that issue. We do know when we first started giving women estrogen for birth control pills, remember, they're not the same.
Not even close.
They're not even the same, like Shawn says, to our normal body. We did have that issue with clotting, and I agree with that. I'm not disagreeing with that. I believe 100% because they weren't the estrogens our body made.
So now that we talked about a little bit about clots, let's talk about breast cancer. That is the scariest thing for women, and we get that question probably daily about. And usually the question is this: well, I heard hormones cause breast cancer. Well, remember how I started this podcast about when somebody says hormones cause breast cancer? If they can't be more specific about that, or if they quote the WHI study, you can go back and watch our podcast and say, well, this is what the WHI study says. And if anybody wants copies of it, we can find it. Google the WHI study. You can definitely find it. And so if that, and also, but breast cancer. So breast cancer risk, we answer that question every day. I want to go back to rational thinking. So, and I get it. I think we have a fear in this culture, in our American culture, of cancer. And I think it's done purposely by the media and by the healthcare system, because I think the oncology industry, the cancer industry, makes a lot of money off treating cancer. That's a topic for a whole nother podcast, but cancer is mostly, our bodies aren't meant to get cancer. Think about it. And we fight off all kinds of carcinogens every day. Things that can cause cancer. We fight them off every day if we have a healthy immune system. The reason we usually get cancer is because we're exposed to something way too much that our body cannot overcome, our immune system cannot overcome. So a lot of times when you get cancer, there's something that's precipitating it. Probably your immune system wasn't able to fight something off. Cancer is no different than fighting off a virus or fighting off a bacteria. You need a healthy immune system. So sleep well, eat well, exercise, be healthy, get outside, sunlight, all that good stuff. So back to the rational thinking instead of trusting the science. And I want you to do your own research. Don't just trust me. Think about breast cancer. When do most women get breast cancer? Not in their 20s, not in their 30s. Usually in their 40s, perimenopause-ish, or in their 70s, postmenopause. Well, think about are their hormones at maximum levels then? No, their hormones are at maximum levels when they're in their 20s and even when they're pregnant. Mostly women that are pregnant don't get breast cancer, okay? And I know that somebody watching or a doctor will respond to me and say, well, yeah, but there's more to it than that. Exactly. That's my point. You can't say that hormones cause breast cancer just on that statement alone. So, and that's exactly right. There's genetic factors, but remember, we can't change our genetics, but we can change the way our genes are expressed by how we treat our bodies. There's a big lifestyle component, and then environmental, lifestyle, and genetic. And all of those we can control somewhat. So again, about hormones, and more specifically, sex hormones, estradiol causing breast cancer. If that was the case, and just estradiol caused breast cancer, then young women would be getting breast cancer. That's not the case. Now, like we said about estrogen and uterine tissue, Here's one of the problems. I'm going to give an analogy here, okay? So think of estrogen as, let's think of tissue. We're going to compare breast tissue and uterine tissue to our lawn, okay? Like our grass lawn, okay? Estrogen is like fertilizer, all right? It makes the lawn grow. So it thickens the endometrium. And it also proliferates endometrium tissue. It proliferates breast tissue. So what does progesterone do? Progesterone is like the lawnmower. It cuts all the bad stuff off, okay, and stops the weeds from growing. Well, what have we done for women? What have we done for women since the 1947 when Premarin came out and we gave women estrogen only? Well, guess what? You overstimulate certain tissues like uterine tissue and breast tissue, and you don't have progesterone there to decrease that stimulation. Again, progesterone. That's what's forgotten about so many times in this mixture of sex hormones. Janet?
Well, Shawn brings up a really good point, because we used to use different methods of birth control. Now we use estrogen-based birth control, which are not
Ethinyl estradiol.
Right. That are not as healthy as what people think. And here's what we're trying to relay in this conversation is that if that estrogen that this woman is going through menopause or perimenopause or even younger in that case is not opposed with progesterone, then it does open some windows up for some problems. But if we think about rationally about cancer, it is not the leading cause of death. It is just the most feared. And I understand why. I mean, I have friends and family that have had cancer. I understand that. But if we really were trying to do something for our population, we would deal with the issue of heart disease, because people die from that every day around the clock. Like, nobody even seems to think that that's an issue.
The number one killer of Americans is cardiovascular disease from heart attacks and strokes. So rather than being scared of cancer, we should be scared of cardiovascular disease. And guess what? Sex hormones can help your cardiovascular system be healthy and prevent cardiovascular disease. There are many studies out there to show that. And let's just think rationally about it. Do young people with healthy hormone levels have heart attacks? No, they usually don't. It's usually people post-menopause or men that are past andropause, which is male menopause. That's when they're having heart attacks, not when their hormone levels are optimal.
Right. So I guess we're giving you a lot of information, but here's the takeaway for me. Educate yourself and really look at what somebody is telling you, because if they really believe that you shouldn't have any hormones, you wouldn't be alive. It's a fallacy. We need hormones. We need hormones to survive. Now, yes, there are times where there will be breast cancer that is fed. The estrogen is feeding the cell. I get that. But it doesn't mean that that estrogen caused that tumor. It doesn't mean that at all. And so there's this myth about that. And like Shawn was talking about, if that estrogen in your body is opposed with progesterone is protective against that. And so is testosterone for women as well. So there's a lot of misinformation that is put out into it, the healthcare industry. And you got to wonder why. Because if we really wanted to get our women healthy, we would be promoting better sleep habits, feeling better, exercising, making sure that we were healthy weight, and taking the excess stresses away so we don't have the stress on our immune system to fight off and ward a bad cell that our body made and that we need to reject and get rid of. So if you can do anything for yourself, if you don't even, trust us, research the WHI and read it, and then look at what sleep does for your immune system, because that in itself, if you can conquer sleep, you're going to be healthier without even taking anything.
That's absolutely right. Now, Janet mentioned testosterone, so let's move on to testosterone. Now, here's one of the misnomers. Testosterone is traditionally associated with men only. Right. Well, guess what? Women have testosterone also, just not as much as men. Testosterone is very important. What are some things that? I'm gonna steal some of the thunder, because this is one thing that I have a challenge, an ongoing challenge with this. I challenge any doctor, any scientist, any pharmacist, anybody. I challenge them to find a better drug for building bone than testosterone. There isn't one. Testosterone is an anabolic hormone. It helps to build a lot of different tissues, including our muscle, lean body mass, muscles, and including bones. The reason women get osteoporosis, one of the most debilitating diseases, more women get osteoporosis than cancer. And do you want to fall down, break a hip, and be in a nursing home for 2 to 3 years of the rest of your life and live miserable? No, that seems like a very miserable way to live. So if you want strong, healthy bones, you will not only have estrogen and progesterone, but you will have testosterone as a woman. And as a man, of course, men get osteoporosis also, but men don't get it from lack of estrogen or lack of progesterone. We get it from lack of testosterone. So there's a lot of fancy drugs out there to treat osteoporosis. And let me just tell you, do your own research. Lots of nasty side effects called osteonecrosis, which basically osteo meaning bone, necrosis meaning death, meaning the bones are like brittle, and they will help make the bones denser, but not stronger. So much so that if you are on those drugs and the dentist asks you the question that you're on those drugs, the dentist will not pull your teeth because they found out they were shattering people's jaws. So those drugs are junk. I would never, ever recommend them. Fosamax, Actonel, Prolia, Forteo. One of those drugs, actually, this is big pharma. This is how they work. They make these drugs to create some kind of disease like osteonecrosis, and then they create a drug to treat it. So one of those drugs, I can't remember which one, also treats osteonecrosis along with osteoporosis. Stay away from all of them because every single one of them, they're indicated for women that are post-menopause. What do postmenopausal women lack? They don't lack Forteo. They don't lack Prolia. They don't lack Fosamax. They lack hormones. So why not balance your hormones? And not only make your bones stronger, it'll make your heart healthier. It'll make your skin healthier. It will increase your libido. It'll decrease your vaginal dryness. It'll decrease your urinary incontinence. It'll decrease urinary tract infections, on and on and on.
So we touched the bones, but we need to talk a little bit about the heart and clots. And let's move into both men and women, because there's a fallacy that there was a study on testosterone that they did, a very good study about how men had a higher risk for cardiac events or stroke when they were on testosterone. So I'm going to turn that over to Shawn.
Okay, so let's just
debunk this one.
Yeah. So I love this one, and I just got to go about it. You know, Jen and I've been doing this for 30 years now. Okay, we consider ourselves experts in this subject. I don't think there are two other pharmacists in one pharmacy that know more about hormones than Jen and I do. I know that sounds very arrogant, but I really believe that because this is what we do all day long, and we absolutely love it. 30 years ago, when we first started doing this, almost 30 years ago, there was a fallacy that testosterone caused prostate cancer. And I mean, I just thought about that, and urologists were like, "Oh my gosh, no, we can't give testosterone because it causes prostate cancer." I just thought about it. I'm like, wait a minute. What age do men get prostate cancer? In their 60s and 70s? They don't get it when they're 19. And let's think about it as men. When are men's hormones the highest? In our teenage years, young 20s. Testosterone's off the chart. Okay. Do young men die of heart attacks? Not from natural causes. Usually it's from some kind of drug, and we won't even speak about the drug that's causing that now. Do young men get prostate cancer? No. So to say that heart attacks, strokes, or blood clots are caused by testosterone alone doesn't make a lot of sense whatsoever. Because just think rationally, then young men would be dying of heart attacks and strokes.
Right. Well, also, let's keep in mind when they took the study of people that they were testing, they were not healthy individuals from the start. So if you look at a study and they don't give you any idea of what population they're taking and making the studies on. So if you're looking at men in their 60s and 70s, they already have how many years of a baseline of their own damage to their heart.
The damage has been done.
Right. It's already there, especially people that have not, they've smoked, they've done drugs or alcohol excessively, or they've led a sedentary lifestyle. And yes, really, there's somebody out there that will not exactly fit the mold. But for most people, by the time we hit our 70s, 60s, and 70s, if we haven't maintained a healthy lifestyle, we start seeing things showing up. They actually start seeing it. And now in our modern day, we can look at things a little bit better. But what they are just trying to correlate it to was it caused it. And that's not true at all, because it didn't happen overnight. It wasn't just when they introduced the testosterone to the men.
Right. And so association is not proof causation. So somebody goes on testosterone, has a heart attack, they blame on testosterone. But, when you look at that person's history, you can say, oh, I'm not surprised he had a heart attack. I mean, he eats like crap. He doesn't sleep. He's been doing this for 20 or 30 years. He's overweight. He doesn't exercise. He's sedentary. I'm not surprised he had a heart attack. And I'm not being cold-blooded here. I'm just speaking facts. And the facts are this. Normally, cardiovascular accidents, heart attacks and strokes, happens because of metabolic disease. Mm-hmm. It doesn't happen because, you were on testosterone or on hormones. You had a metabolic problem already. And go ahead.
In fact, using testosterone to increase at normal levels, we're not talking in the bodybuilder side of this world or, professional athletes. We're talking about people that had normal testosterone levels. It's actually protective to them. It's actually very helpful to them. Testosterone helps with lean muscle mass. And we're not talking about rebuilding huge. We're just saying, let's have healthy bones. Let's have healthy muscles and waistlines. It makes a huge difference in their overall cholesterol panel. It's night and day. You can look at somebody's labs and you can almost say this person's metabolic or this person's healthy just by looking at their labs and not even seeing them, which, I kind of cringe because we don't like to chase labs. Shawn and I talk about that a lot, but the whole myth that because you were giving a natural hormone that is identical to your body, all of a sudden just you produced a blood clot from it is a total
myth. Great.
It's
crazy.
It's not a valid comment. No. It's totally misunderstood.
Yeah. So we have a question. We love keep your questions coming. This is a long one. Thank you, Kayleen. Hope everything's going well. I went to high school with you. I think you still live in Othello, I believe. I'm not sure about that, but thank you for your question. Women's healthcare is very misunderstood. Ambien is a very dangerous drug. Absolutely. Any drug you use for sleep is a dangerous drug. I know of people that have done bizarre things in their sleep. Absolutely. Retrograde amnesia. You can do things that you don't even remember. It should only be used as a short-term medication, 10 days or less. Agree with that. And that's in certain trauma type situations where it's going to be very, very short term. Other meds should be used for long-term medication, for long-term sleep medication, in my opinion. I'm just going to tell you, Kayleen, I don't think any medication should be used for long-term sleep. Also, alcohol? No. Also, marijuana? No. And I know because marijuana is legal in Washington State and all these states now. Well, I use marijuana now instead of using Ambien because it helps me sleep. So what? You're replacing one drug for another. It doesn't work that way. That is not the way your body is meant to sleep. Maybe you can talk about that one day if you have a different opinion. Can you talk about over-the-counter birth control pills that are now being offered to the youngest generation? Let me just tell you birth control pills in general. I did a video that went viral on this, over 500,000 views on Instagram. That is one class of drug that I would never, ever, ever, ever recommend. I would never recommend birth control pills. And I know there are haters out there watching right now saying, well, what do you recommend? Well, first of all, think about what the control pills do. They suppress the own body's endogenous production of hormones. So it basically takes your own estrogen and progesterone and just lowers it. So if you've ever checked a woman's hormone levels when they're on birth control pills, it's like they're non-existent. Their estrogen levels low, their progesterone levels low. Is that a good thing? No. We talked about how those I'm sorry, I keep putting, I know it's a small camera. We talked about how those things help increase your cardiovascular system, increase your bone density. If you don't have them, that doesn't happen. But, Big Pharma loves giving people osteoporosis. I mean, because then they can treat them later on in life. And can birth control pills cause osteoporosis? Absolutely they can. Can they cause blood clots? Absolutely they can. Fibroids, headaches, decreased libido, all these, depression. So what do? we have a woman on birth control pills and she gets depressed. What do we give her? Prozac. Oh, she must have, a Prozac deficiency. I know I'm being cynical here because it's ridiculous to me. So usually when a woman comes to us and a doctor sends a woman to us and they want a recommendation on hormones, if they're on birth control pills, the first thing I say is get them off. That's the first thing. Most of these symptoms are caused from birth control pills, and we can't overcome that by giving, I'm not one to try to give drugs to overcome a side effect. Get them off the birth control pills. Here's a quick thing. The first thing I will say is, are they in a monogamous relationship or are they married? And, sometimes a woman's like 48 years old and they've been married and they're done having kids. I'm like, okay, this is a no-brainer. She's got to go off the birth control pills and her husband's got to get a vasectomy. And then the woman will say, well, my husband won't get a vasectomy. Then this is what I tell the woman. Then you should stop having sex with him. And then maybe he'll change his mind. That's the answer.
But there's other methods. Yeah,
there's also other methods that we've used for thousands of years before birth control pills were even talked about or offered.
So the point is that if you have a long usage of birth control pills, it can interfere with a lot of things down the road if it's not already.
Absolutely. Laura, one of our loyal viewers, listeners, thank goodness for hormones. Absolutely, Laura. Let's see. You have a question too. Why aren't men offered T as they age? For the same reason women are not offered PET, progesterone, estrogen, testosterone. Mm-hmm. Well, Laura, if men are not being offered that, it's because they're going to the wrong doctor. Because if men go to the right doctor, they should be offered that. Let me give you an example. 45-year-old man comes to the doctor, and for the first time in his life, he has increased cholesterol. What does the doctor do? Well, sir, you must have a statin deficiency, so we're going to give you Lipitor to help lower your cholesterol. Well, if the doctor would have checked his testosterone is probably low, and testosterone is actually made from cholesterol. Sex hormones actually are made from cholesterol in the hormone cascade. So when your testosterone is not optimal, your cholesterol level can go up. Now, the whole cholesterol debate's a whole topic for a whole other day. But I personally think it should be medical malpractice to put somebody on a statin without checking their testosterone, also their thyroid. Another thing is that same 45-year-old man, well, doctor, I all of a sudden have erectile dysfunction and decreased libido. Oh, that's okay. You must have a Viagra deficiency. We'll give you some Viagra or Cialis or Levitra, whatever the drug of the day is, right? Without checking their testosterone. Same thing. Without adequate testosterone levels, you can get erectile dysfunction. And the man just happens to be depressed also. Doctor, over the last few years, I don't feel as good. I don't feel as competitive in the gym. I'm getting some weight gain around the middle and I'm just kind of not feeling as strong anymore. And I'm kind of just depressed, not feeling good. Oh, well, that's great. We've got this great drug, Prozac. Prozac will help you. Name the drug, Effexor, Zoloft, Celexa, all of them are the same. There's some new fancy ones out there because those go off patent and they're generic now. So drug companies have to make billions of dollars on new ones. They're all the same. I would never, ever, another class of drug I would never recommend is antidepressants. Go to our video from last week with Kelly Folkrod about antidepressants, and they're not valid. So testosterone should be addressed in every middle-aged man over 40. And actually, and thyroid. And actually, you should get your testosterone checked before you're 40, so you know what your levels are when you're feeling good. So when you're 50 and you might need testosterone, you can go on testosterone and have an optimal level rather than just a normal level. There's a difference between being normal and being optimal. I hope that answered your question, Laura. Please ask more. I feel so much better after being on medical hormones. That is awesome to hear, Margaret. Thank you for commenting. And Kayleen, yes, I will tell you the marijuana thing, it drives me absolutely bonkers. And because it's something that has been, legalized, when we were in high school, it was illegal. And even though people were doing it all the time, it was illegal. So, and I'm not, just to let people know, I'm not for the government legalizing or illegalizing drugs. I don't believe prohibition works, but I will tell you this, that I don't think drugs are the answer to treat all kinds of problems. And since marijuana became legal, people have used it for all kinds of stuff, pain and sleep, and it's still a drug. And whether it's legal, illegal, or prescribed, if you are using a drug to treat a chronic problem like sleep, it's a problem. I don't care what drug it is.
You need to address the core issue. So I would say for some of my clients, when they need something for sleep, especially men, once they are on testosterone, that's going to help, believe it or not, they actually sleep better. And also I reach for melatonin for a short term, and melatonin is really our sleep hormone, and it can be very off. That's why teenage kids are hard to get out of bed in the morning, is because their cortisol and their melatonin is off. But there's a lot of things that people need to do for themselves. Don't watch TV right before going to bed, or, on your phone or computer, or, making sure that you have the right temperature in your room, or making sure that you have the right habit of going to sleep. Because if you're a shift worker and you've worked all kinds of hours, usually your rhythm is off. And so correcting that can be a challenge. But taking Ambien, I believe, is actually very harmful. I know my mother was a nurse that worked nights, and to this day, she struggles with her sleep. But once you go down that road, it's hard to take it back. And then, do you really get good sleep when you're on those? You don't. You don't get into your REM sleep. So I don't feel like that's the right answer. So balancing hormones does help with the sleep part of it. So, of course, Shawn and I have talked about all kinds of things, but like for us, this last few days, we've been outside more than we normally will. So we sleep really good. So, maybe if you're struggling with sleep, getting some more outdoor time or just some exercise is going to make a big difference. I mean, what do we do with our children when we need them to start sleeping better? We wear them out. We get them outside in the outdoors, and man, it doesn't take long once they're in their house and, put to bed before they fall asleep. So, think about the causes of what is disrupting the sleep. Don't reach for the medication.
And Kayleen has another question. Since you mentioned marijuana, could you do a podcast on the effects of marijuana has on the body and mind, especially if you have surgery? It's worth revisiting. We have done that. I will try to share, message me if I forget, but I will share that podcast with you. But it's definitely worth revisiting. I think because it's so ubiquitous now, because it's legal, there's a lot more coming out on studies, because you can do studies, because it's not underground like it used to be as much. So the problem, they're seeing more effects. I mean, all kinds of effects on, delusions and psychosis, all kinds of problems with marijuana, and whether anybody wants to admit it or not. And I'm not apologizing to anybody that's a regular marijuana user out there. I'm not apologizing to anybody. I'm just stating the facts. I'll say the same thing about alcohol. Alcohol is a poison, period. And for anybody that, doesn't want to believe that, just look it up. And marijuana is no different. Marijuana is probably not as toxic as alcohol, because you won't die from it, at least short term initially. But long term, if you are having a drug that affects your CNS, your central nervous system, your brain, it just can't be good long term. I mean, it just really can't. And the side effects are coming out on marijuana. And yes, I don't care what anybody wants to say. And when our kids were younger, we educate them on this kind of stuff for sure. And of course, that's kind of when the culture, 20 years ago, when the culture of, marijuana, medical marijuana becoming legal was coming out. And so our kids were getting a totally different side of it. And we just had to tell them the truth about it. And the truth of it is it affects your CNS. And there's probably a lot of other things that it doesn't affect. Second of all, if you were smoking any kind of drug, that just can't be good for your lungs, period. And what else about marijuana? Oh, it's a gateway drug. I don't care what anybody says. It's a gateway drug. So is alcohol. And it just leads to other things down a path. Let's see. Laura has another question. How does diet affect hormones? Vegans claim it's healthy, but what does it do to our sex hormones?
Okay.
Janet, I love this one.
I really have to jump into this one, Laura, because one of the things that we have done in our culture is tell women that we have to eat the same amount of calories as men. So since I have 2 boys and a husband that are extremely active people, if I ate as much food as they did on a day where they, were very active, I can't even imagine how much weight I put on. So let's put that in perspective. The amount of calories that we need for a daily lifestyle. Obviously, I'm going to eat different on days that, Shawn and I are doing activities where, it's going to require more. But I'm very mindful, especially after menopause, about my activity level and how that goes to food. Because remember, we use food to nourish our body. It is not always a requirement. So we would die without sleep before food, right? So where I'm going with this is I look at my activity level as to what should be the right amount of calories that I would consume during the day. If we're going to go off on the vegan part of it, first of all, I'm not opposed for people eating fruit and vegetables at all. I think they augment our food, and there's nothing wrong with it. Where I really struggle is with the box carbs, the fast food stuff, the stuff that isn't, it's garbage. It's not healthy for us. But we still need to have protein in our diets. And that's one thing that I really lean towards for women, because we usually don't eat enough proteins because we need to maintain the muscle mass as we age. Our muscle mass is huge for our bone health. It's huge for our overall cardiac health, because if we can keep our muscle, which proteins help when we eat them, maintained, then we're going to be healthier. So I'm going to go back a couple of years ago, I had a procedure. And one of the things that the doctor said was make sure that you have enough protein in your diet so you heal properly. We tell people that after procedures, at least if you have a good doctor. So I don't think enough plant-based protein is available out there to get the nutrients that meat has. And I'm not a one, I'm not way over here on the carnivore. I'm not way on any diet. I really think that what has to work individually for each person. And so what I look at is activity as to what maintains too, like maybe somebody the same size and the same activity level might need a little more caloric to maintain a weight or not. I mean, we do have metabolism and there's some differences there, but I really think that we have to be mindful of the food. And it depends on, it really depends on people's activity level as well as metabolism. What do you want to add to that?
Well, I mean, so for one thing is, our bodies need to be healthy to produce hormones, and hormones is a very broad term. We already went through that. So
right.
think about cholesterol. Cholesterol with sex hormones is up here, okay? And all the hormones are produced from it. And starting with pregnenolone, progesterone, all the way down at the bottom, and the estrogens. So if you don't have enough healthy cholesterol, then you cannot produce those hormones. Well, where does cholesterol come from? It comes from mostly animal sources. I get it. There can be some cholesterol in plants and stuff, but which is an animal source. So there is no better source for protein than animal sources, whether it be chicken, whether it be beef, whether it be pork, eggs, fish. Yeah. And cholesterol, especially in more of the red meats and the less lean meats, like beef, possibly. And then what about iron? Mm-hmm. We see it frequently when we get some of these labs back and they all have low iron levels, and I'll ask them about their diet, and they'll say, "Well, I'm vegan." Well, you probably didn't need to tell me that. I asked you that, but you didn't need to tell me that because I can probably tell. And there is no better source of iron than red meat. Period. There is no, even over-the-counter supplements are not near as good as red meat. So if you want to increase your iron stores, eat red meat, period. And let's go back to rational thinking. And believe me, there's some smart doctors out there that still believe the fact that a plant-based diet is healthier for cardiovascular health. Okay, let's think about it this way. As humans, we've been eating red meat for thousands of years. If it was bad for us, it would have wiped us out thousands of years ago. That's just a rational thought. So thank you. That's a great question, Laura. And like Janet said, I believe we're omnivores, but I also believe that if we're going to focus on one thing, focus on protein And doing that from a meat source is much better than a plant source, because you just got to eat so much of a plant source to get enough protein. I want to answer Kayleen's question, because marijuana is a hard subject, but it's legal, but it has so many side effects. It's hard to get people to listen anymore. This is what I want you to understand, Kayleen. This is what I want you to tell those same people that say, well, it's legal. Guess what? So is smoking cigarettes. So is chewing tobacco. We understand the dangers of nicotine and the dangers of tobacco, and how it's killed thousands of people, hundreds of thousands of people over the last few decades. Remember, the government still made it legal. And there was a time in the 1950s that the government promoted smoking, and doctors promoted smoking as being healthy. Again, do your own research. If you were putting any kind of chemical in your body, again, alcohol is legal. Maybe you can tell the people, is alcohol good for people? And there might be certain instances where it could be, but definitely not in excessive amounts. So that's what you need to tell them. Just because something is legal doesn't mean it's good for you. And look at a lot of the legal drugs that are prescribed that are poisons, chemotherapy being one of them. And yes, it's definitely a gateway drug for sure. Okay, let's see. Mike Nachi, have you tried microdosing? It involves natural substances like mushrooms, not to trip, but to help improve mental health. Panic attacks, chronic. Actually, Mike, I mean, I understand what you're saying about microdosing. It might have a little bit to do like with homeopathy. I don't know a lot about it. But I'm a big believer in that if we treat our bodies correctly, sleep, exercise, and diet, and we get appropriate things like mushrooms, for instance, if you can eat mushrooms in your diet, and there is some benefits of that, immune health and things like that. I'm a big believer in getting that from our diets first. And, Janet and I own a pharmacy. So we make money selling supplements, but in general, supplements are just that. They're to, no matter what the dose of a supplement is, they're to supplement a good, healthy lifestyle already. They're not to overcome a bad lifestyle. Maybe short term, as you're fixing your lifestyle, supplements can help, but long term, supplements are just that. They're to help supplement a good, healthy diet and lifestyle already. Great question, though, Mike.
So, going off of these thoughts, usually a sleep disorder is also a problem with your cortisol levels, and that is partly brought on by lifestyle. And if we can't get our cortisol balanced, then, we can struggle with that. So a lot of times I've had somebody that, we've tried some melatonin and they're still not, and I feel like their cortisol is spiking in the night, or they're anxious before going to bed and not, then we reach for herbs that help bring that cortisol level back into line. Melatonin does some, but there's some adaptogens that are very helpful for people that help to keep the cortisol higher in the early part of the day, and as the day progresses lower. And I feel that's the natural rhythm of the body, high and then low, higher melatonin and then low in the morning. So I'm not opposed for people using something short term, but it's the long term thing. And I really think there's a problem with somebody's cortisol levels if it's an ongoing thing, especially if they're having anxiety and sleep deprived.
Cortisol should be produced in a diurnal fashion. Diurnal meaning daily, highest in the morning, lowest at night when we should be sleeping. And it's inversely proportional to melatonin. So cortisol is usually high, melatonin is low. Melatonin should be high at night, cortisol low, so you can sleep. If that's not happening, then that's a problem. That can happen commonly in people that are night shift workers or used to be night shift workers. And one of the first things, or in any kind of shift worker that are working more at night or in late hours rather than during the day. And I'll just tell them this, look, at our bodies were created diurnal, to be diurnal, work during the day and sleep at night. And so if you're a night shift worker and it is affecting your health, I don't think that going on Ambien or some magic drug or hormones for that matter is going to fix your health problem. No. You need to get a different job.
It's like Band-Aiding.
Yeah. Fix the problem. Yeah. Don't just treat the symptom.
The root cause is what we're talking about.
Right.
Fix the root cause. Because, using something to Band-Aid something is going to come to an end, in my opinion. Most of the time, most of us as humans know the answer. We know where we are lacking something. We know the answer. We just need maybe guidance to get to that point as far as how to deal with it and change it. I can't tell you how many women that I have had over the years that has said to me, I can't sleep and I feel absolutely horrible emotionally and mentally. And once they start their hormones of progesterone, they start sleeping and they start dealing with whatever stress is in their life, what's causing the stress, how they're handling the stress, and getting their cortisol levels to the appropriate time of the day, high in the morning and low at night and throughout their sleep, then it's a game changer.
Absolutely. And so that about wraps our podcast up. So I just want to let you guys know that I thank all of you for your comments and your questions. Great show today. I absolutely love doing a show with my wife because she's just a wonderful wealth of knowledge, and I learn something from her every time she speaks. We stream live on Facebook. We have a couple different Facebook sites. Our Moses Lake Professional Pharmacy site, my personal Facebook. We have a Health Solutions, which is our podcast site. Please like those pages, follow them, share them with your friends if you like this podcast. We also stream on LinkedIn and YouTube, and you can find all these subjects, everything we've ever talked about, every podcast that we've ever had on our YouTube channel. So go to YouTube, Moses Lake Professional Pharmacy, and if you search inside that channel, for instance, Kayleen, if you search inside our channel for marijuana, you will find all the times we talked about marijuana. It's a really, really cool feature. We have over 2,200 educational videos on our YouTube site. And our goal is to educate and empower individuals to take charge of their own health. And I think we've helped people realize that goal today. And that's really, really what we want to strive for. Also, don't forget Twitter. Those that are on Twitter, we stream on Twitter. So share it on those. If you're
Is it Twitter?
Oh, it's X. Yeah, right. I just cannot get used to that at all. But if you are commenting from Facebook and you want to share with a friend, make sure that if they're not on Facebook, make sure that that you can share it from YouTube, or you can share it from Twitter or LinkedIn. So that's a great way. Also, message us on any of those platforms and let us know what subject you would like us to talk about. Anything healthcare. And speaking of anything healthcare, one of the things that we promote in healthcare is free markets. Free markets in healthcare, i.e., there's a consumer and a healthcare professional. There's no health insurance in between. We believe in free markets. We believe that's what keeps prices down, service up, and quality up. And we will be flying out to Oklahoma tomorrow to the Free Market Medical Association 10th anniversary meeting in Oklahoma City.
Very exciting.
We're super excited. And we'll be meeting some great people in the healthcare free market medicine healthcare industry. And we're super excited to do that. This will be our 4th year, I believe. I'm going to hook up with Barty McCary, hopefully, who talks about how government intervention is what made healthcare expensive. So if people think healthcare is going to be cheaper if we had a one payer or if the government got more involved, well, the government is already 85% pays for almost 85% of all healthcare now. And so if you think healthcare is expensive, getting the government involved would even make it more expensive, and the quality would go down and the service would go down. I personally do not want the government dictating my healthcare. I want to dictate that between me and my doctor, or me and my healthcare professional, whoever that is. I don't want a third party intervening between me. So follow us, and you'll find out more about the Free Market Medical Association. The 10th anniversary of the meeting will be flying in there tomorrow. So as always, it's a pleasure to do this podcast. Thank you, listeners and viewers, for tuning in to Health Solutions with Shawn and Janet Needham. Tune in. My days are kind of messed up because it seems like a weekend to me because we're in Moab, mountain bike racing. Tune in Wednesday. It'll be Janet and I talking about free market medicine. We might be interviewing somebody, maybe not. But tune in so you can learn how to get better health care without insurance. That might surprise you, but insurance is what makes healthcare expensive and what makes the quality and service go down. And healthcare is not expensive in a free market. Janet and I pay very little for our health care because we pay cash out of pocket. We don't have traditional health insurance like a lot of people because we want to make those decisions, not a health insurance make those decisions for us. So our healthcare expenses are really not that high. So tune in Wednesday. We'll be having a podcast. I don't even know what time, but tune in to Health Solutions with Shawn and Janet Needham. Thank you for tuning in today.